Technical Veterinary Learning Channel presents third part of equine influenza lecture, which includes pathogenesis of the disease, clinical signs of diseased animal, post-mortem examination. This part presented by Professor Ahmed Mamdouh al-Sharif, Professor of Infectious Diseases, Department of Veterinary Medicine, Faculty of Veterinary Medicine, Bani Suef University, Egypt. Pathogenesis of equine influenza disease. The incubation period is about 2 to 3 days. By mean, the time elapsed between entrance of the virus and the appearance of clinical signs is about 2 to 3 days. Inhaled viruses of equine influenza disease will attach themselves to the respiratory epithelial cells. Then viral replication occurs in the pharyngeal mucosa that leads to cellular death, inflammation, edema, loss of protective mucociliary clearance. This will enhance occurrence of secondary bacterial infection, will become pneumonia. Deaths due to pneumonia in endemic areas is very low, reach to 1%, but in epizootic areas it reached to 20 to 25%. Clinical signs of equine influenza disease. Sudden onset of equine influenza disease began abruptly. Equine influenza disease spread rapidly within 2 to 6 days and an outbreak in any area. This diagram shows beginning of the infection at 0 day by one horse, ended by at 2 to 6 days by all the horses of the country or the state or the area. Equine influenza course of the disease reached to 2 to 3 weeks in some animals and reached to 6 weeks in weak and untreated one. This chart summarizes the clinical symptoms of equine influenza. The animal is lethargic, not eating or little interest in feed, has husky coughing, has a watery nasal discharge, enlargement of lymph nodes, especially the intermandibular one, feverish with elevated temperature reach to 103 to 106 Fahrenheit or 40 to 41 centigrades. A horse suffering from fever. This picture shows a horse suffering from depression and anorexia due to the beginning of equine influenza disease. Infected horses reluctant to move. A picture of a horse suffering from lethargy and stand to the wall. A recumbent horse. A recumbent horse. This is a picture of a horse suffering from dry hacking cough, which changed to the moist one that lasts for 1 to 3 weeks. This is a picture of a horse suffering from dry hacking cough, which changed to the moist one that lasts for 1 to 3 weeks. Equine influenza disease course Cough develops early and may persist for several weeks, reach to 3. Secondary bacterial infection leads to purulent nasal discharges in equines diseased with equine influenza. Secondary bacterial infection leads to purulent nasal discharges in equines diseased with equine influenza. Secondary bacterial infection leads to purulent nasal discharges in equines diseased with equine influenza. Horses catching equine influenza disease were suffering from submandibular lymphadenopathy, where lymph nodes become painful and enlarged during palpation. Auscultation of the lung area will show all abnormal lung sounds such as dry rales, moist rales, crepitation, and whistles. Examination of the lung area. This chart shows the examination area of the lung, and this will be coming in the physical examination of respiratory tract of the horses in a following video. Mildly affected horses with equine influenza will recover unevenly in 2 to 3 weeks. Severely affected horses with equine influenza may show convalescence as long as 6 months and may be showing death. In some cases, complete restriction of strenuous physical activity of affected horses will hasten the recovery. Complications of equine influenza disease. Untreated and unfollowing horses may showing one of the 5 complications: bronchopneumonia, lung edema, myocardial damage, emphysema, and myoglobinuriria. Maybe one of them occur or more than one can be occurred according to the health status of the affected animal. Postmortem examinations. During the necropsy of horses affected by equine influenza, we will find mucous membrane of the upper respiratory tract is very hyperemic. Dead horses from equine influenza may show also primary complications of vasculitis, myositis, myocarditis infrequent. A picture of pneumonia in donkey's lungs, where areas of hyperemia were shown. Pneumonia in horse's lung due to infection with equine influenza, where areas of hyperemia and areas of atelectasis have been seen. The fourth part of equine influenza lecture will be followed. If you're eager to reach to all new videos and lectures about veterinary infectious diseases, please subscribe the channel and follow us.